I'm going to talk briefly about two journal selection sites that are very helpful for our research in general. We use it, the students use it, and we want to introduce it to you. One is called Jane, and one is the journal finding from Elsevier, which is a publication company of many of the journals that we review and we read and we use. Uh, and it helps you to find the journal site. And I'm presenting this now because it's very important for you to choose your journal early. It's going to really help you get organized and how to write your article, what kind of figures, what length. It has all the details of how to write an article that's going to be accepted by this particular journal, so you don't waste time. And it also guides you, so it's a good guide for you to have and use this tool when you want to find the proper journal, the more adequate journal for your um, for your article that you're publishing. So it's called Jane, which is Journal Author Name Estimator. Jane, Journal Author Name Estimator. It's in English, but you can find also in other languages. And then it allows you to insert your title and abstract, and then it will find or keywords, and it will find the article for you. So if we go to the site, Jane biosemantics.org, you get this page. Here it is again, Jane, journal author name estimator. And in here, you would add the topic that you want. So what is Jane? Jane is, welcome to Jane. You can read here the specifics of what they, I'm gonna read Jane because, okay, now. Have you recently written a paper, but you're not sure to which journal you should submit it? Or maybe you want to find relevant articles to cite in your paper, or you are an editor and you do need to find reviewers in the particular paper or topic, and Jane can help. Just enter the title or abstract of the paper in the box, in this box, and click find journals and find the authors or find the articles. You can search for all these things: a journal, the author of the journals, the authors that you know, or articles written on your topic. And Jane will then compare your document to millions of documents in PubMed to find the best matching journals, author, and articles. You can also search by keywords or the title. And it's a very important topic that I want to introduce: the predatory journals. I don't know if you have heard of this, but the predatory journals are companies that are going to offer to publish your article, but they are not real index journals. So there are companies that make up a fake journal with a very attractive name, and they offer you, and they keep writing to you. If you're a published author and you have your presence in the literature already, you might get this email saying, yeah, we offer to publish your article. Please, apply to our journal. We find your research very interesting, and they will charge you a fee, and it's not a real peer review journal. So I just want to make sure that Jane relies on the data in PubMed, which can contain papers from predatory journals, and therefore these journals can appear in Jane's result. To help identify high-quality journals, Jane now tags journals that are currently indexes in Medline and open access journals that are approved by the Director of Open Access Journals. So the articles that we find in Jane and Elsevier, which is the other site, are going to be already protected from these predatory journals. But it's something you have to have in mind when you do your search, and do not accept offers that arrived, just very attractive offers to publish your articles. So then I just thought to enter in the box Zika and brain defects, which has just occurred to me right now, and it gives you all these articles. And it says here which ones have been published. These are all reliable journals. Sorry, it gives you I asked for journals, so if you go back, Zika and brain defects, or you can add the abstract that you have or your full title. I would just, I just thought of a few keywords real quick. And I said, find journals. So you press here and you get all the journals on that topic. Of course, the topic is a bit broad because, Zika and brain damage, there's a lot, but since it happened in children, you have a lot of pediatric infectious disease journals, clinical pediatrics. I don't know if you can read them, but you can do the exercise yourselves. And then you can see which journal will apply to you article, New England Journal of Medicine. And then you can actually then review the article and get more details on that particular journal. So this is a tool I want you to use early on, if possible today, so that we can start selecting your articles. Most of you of the group that the full participants have good data that they should be thinking already about finding articles. And this is finding, okay, the other one was finding journals. And then the same topic, I said, find articles. So it gives me all these articles that have been published. If I want to find more literature on the topic I'm studying, it's impossible for you to read, but I'm just showing you that it gives you um, a list of articles if you're looking for literature or examples of articles that are very similar to yours, and then you can apply to that journal as offered as a publisher, as your journal to publish in. Sorry. And then the Elsevier, which is the other database that we use that finds the journal. It's here, journal finder for elsevier.com. I just have a screenshot of, but it didn't show really well. It the same. You add you select the field of research, or you add the keywords or your title, and then you find the journals, and it gives you using your samples, medicine, social medicine, experimental sciences, and many other topics that you want to, and it finds the journals. Well, this is the boxes where you enter your information as much as you want or not. I think I continue with the Zika brain damage question, and it gives you a list of journals that didn't copy well in my presentation, but it also gives you the impact factor, and it gives you what time it takes for them to publish your article. So like time of publication for Neurologia, which I think is Brazilian, I'm not sure. It's 102 weeks. Oh my God. So it's a very popular journal. The acceptance rate is 26%. Oh, okay. Time of the first decision is 9 weeks. So they tell you in 9 weeks if they're going to accept you or not. So you have to wait 2 months plus. And then you have 102 weeks for the first publication. This other one that didn't show well, it has an impact factor, which is a little bit higher. A 19% acceptance rate only. They take 2 weeks to make you give you the decision you're going to publish, and 41 weeks to actually publish. So I put this in because I wanted to talk about the impact factor. Journals advertise their impact factor, which is it's a formula they use to see how popular it is in the scientific community, how popular it is this journal for publication. So what they do is they go to the year previous, let's say to 2020, and they they take all the articles published in this year, divided by the total citations of the articles in that journal. So they measure, the impact factor measure how often people cite articles in that particular journal in a year. So the higher the better. So the impact factor varies from journal to journal, and the most popular, high tier have a better impact factor than the ones that are not so popular. And the journals advertise these to give you an idea of how visible your article would be, because it's cited a lot. And there's a formula to do this if you're interested, but that we're not going to cover this right now. So I just wanted you to know what impact factor is. So that's all what I wanted to share. How do I stop sharing? Did I stop sharing?
No, we can still see your
You can
PowerPoint.
see my PowerPoint.
Now
Okay.
it's gone.
Okay. So we could make an exercise so it's clear. I don't know if we can ask. There's 4 questions in the Q&A. I can open my browser and share it with you and do an exercise so it's clear what you want to do. You can do with Jane and Elsevier.
Yeah, there are a few questions in the Q&A. I don't know if you want to answer those.
Yes, please.
So one is, how can we identify a predatory journal?
Yeah, that's a good question. You have to be very careful. You have to check if it's cited, if before you accept their offer, you find out if it's a peer reviewed, if it's cited in Medline or PubMed or any other search engines that you use, to make sure that it really exists and it's peer reviewed and it's cited in these other places. If you get an offer to publish, that's already a red tag, right? We usually don't get offers to publish unless you're very famous in the field and you already published. And then if they are listed as possible journals, they won't appear in Jane or Elsevier and these very reliable sites. So you can do a Jane search and see what it brings, and then you can look at the journal and see what they are published, but just don't accept any offer or any journal that that it seems very easy to publish in. Just please make sure they are peer reviewed. I don't know if Gregorio has anything to add, but at the end on Thursday, I have a talk on ethics and publication, and I touch on predatory journals on Thursday.
Yeah, I just agree with what Marilena just mentioned. Some papers you see as a predatory journal when they are trying to get your publication no matter what, and it's a very easy kind of peer review as well, and you probably don't want to go there. You want your paper to be to have a better review process and fair review process. You don't want it to be extremely difficult but not too easy as well. So you see, when they are pushing too much to get publications out of you, that probably is not a good sign. So I would be careful with that. Always check the reputation of the journal as well. Sometimes that can help you to define whether there's a good place to send your publication or not.
Okay. Any other questions?
Yeah, if a journal is in the directory of open access journals, is it reliable?
Yes, yes. Open access journals are as reliable, and some of the one in the search I did are listed, like PLOS and others that I forgot at the moment. That is a very different. Open access journal means they don't charge the reader to read the articles. You don't have to sign up for the journal, but it's open for you to to read, but they are highly peer reviewed. And again, if they are quoted and they have a good peer review, they are acceptable. They are moving more and more towards open access journals. In the University of California, for example, they are trying to not have to pay for the readers to use the journals. And of course, the journals are fighting back because they want the funds to, people to pay for their services. So we're moving in that direction, as many other journals are going to become open access.
Thank you. There is a renovation going on here. Sorry if you can't hear me properly. But the other question is, if one journal rejects your article, can you approach another journal, or how best should one proceed in such a situation?
Oh, yes, of course. You actually, I talk about on Thursday also about the journal process of submitting your article, and it takes several tries. You rarely get published the first try. Either the journal asks you to make reviews or rejects you. The only thing that you have to be careful about is you have to wait until the first journal rejects you to apply to the other one. You cannot apply to several journals before hearing from the one. So that's why you have to choose carefully which is the journal that you're going to submit that has the highest probability of publishing you and are interested in that topic. And then you have to wait either 2 weeks, 4 weeks, whatever each journal said. The more famous, the more time they take. And then once they reject you, then of course, you apply to other journal, and then they reject you and you apply to other journal. So in my experience, my first case, I wanted to publish in a very high tier journal and it was rejected. When I was a graduate student, I was devastated. But you, of course, gather your data, make the corrections, improve your article, and submit it to another article. And of course, it was published eventually, but it's a process which most of us go through.
Yeah, just to comment on that, it's very normal first submissions to get rejections. So that's absolutely fine. That's what everybody goes through. Yeah. And what you want is from a journal, when you submit, you want to hear at least from the editor as soon as possible whether your paper is going to be submitted to revision or not. Because if they take so much time just to tell you whether it's going to be reviewed or not, that's already not very good. It takes a lot of your time. And if it's not, then you can just submit somewhere else. And once it's sent to revision, you also don't want to wait forever to hear from it. Usually within a few weeks or a month is like a good average time for waiting to hear the first notes on your publication.
Yes, it's very unpleasant to have to wait and wait and wait. So like Gregorio said, if you don't hear from the editor, you write to the editor and see which is your place in the list to be reviewed. Another question?
Yes, thank you very much. Greetings from Berlin. I work at the Charité at the Quest Center.
Hi.
And we are doing a lot about open access and predatory journals. So I just wanted to have Adam's small comment. So if you find a journal and you are not sure about whether it's predatory or not, there is in internet a bells list. I wrote it in comments as well. It's not updated anymore, but it's still a good place to start. And there is a caveat that it included frontiers as well. They said that the Bell is still a librarian, a university librarian who just made this register of a lot of journals who he said are predatory. And he included frontiers. And the frontiers, it was very controversial because Frontiers in Neuroscience, for example, is not really a predatory journal. And another option which we did here in Berlin, and it regards open access, because in Europe, a lot of grants are requiring open access publications right now. And a lot of journals, predatory journals, are saying that they are open access journals, which is, you need to be very careful. And we made from the Charité a white list, a positive list of open access journals. And I will post it in the comments. it's updated from time to time. But if you want to make sure, like we excluded, not I, my colleagues, they worked for 2 years on this list. So they excluded most of the well-known predatory journals. And this is an option if you want to, if someone wants to check that, it's a start, which we
So
are doing.
Lana, is it okay if you share that website in the chat so that
Yes.
we can have it? And
Yes.
I would like to have it as well because we can take advantage of the hard work that your colleagues did for 2 years.
Yes.
And
it's now in the chat. If you look at it,
okay.
it's now in the chat.
Thank you very much. That's very valuable. It's an ongoing battle, you know, like it is nowadays with fake news and fake information. And okay, another question.
Right.
Just
Oh,
another
sorry,
comment on that. So it's
Yes.
what is also really increasing in the field. It's as Marielena said, the journals are moving more towards open access because of the pressure of the scientific community. But there is already a really big, nice resource for showing your data, and some journals are accept if you co-submit your paper to the bioarchive. Bioarchive is a place where you have a lot of your papers. You can just publish it straight away. It's not a peer-reviewed process, but it's a way of showing the drafts of your paper while you're submitting to another journal at the same time. So basically, you make your paper open access to everyone. People know that it's not a citable source, so you should not be citing papers from bioarchive because they were not peer-reviewed, but you are revealing your paper and your data to other people. And this is particularly important during a pandemic when there is no time to be waiting for publication times because we need the information by tomorrow. And therefore, whenever you do that, you can submit your paper to your journal, and at the same time, you co-submit it to the bioarchive and make it readily available to everybody, especially if you have important information that is important for public health measures, for example. So bioarchive is really growing right now, and a lot of people are co-submitting there as well. So you can make it available to other people.
Right, thank you so much. So we had some requests here in the chat asking you to do a demonstration. So I think this might be interesting if you think this is something that could be done.
I could share my screen with Jane. You see it?
Yes.
So you just enter in your browser that website I gave you at the beginning of the talk, and you can copy it. I can put it on the chat, or you're going to get this talk at the end of the day. So this is what you get, Jane, author, name, estimator. And I don't know which topic you want. Let's do something that is not Zika and brain damage, but I need ideas. What about Luisa or Gregorio? What should I check? Something on dengue, something on, oh my God, COVID.
Dengue, yeah, COVID will have several. Dengue antibody-dependent enhancement.
Dengue antibodies. Or somebody can put in the chat what they want. So you put this, you can put your whole abstract, you can put your whole title, but then let's find journals that do dengue immunology, maybe. No, dengue antibodies. It just the broader you put it, the more journals. So find journals that publish on dengue antibodies. So here it is. It's a long list. Well, not as long. And we have the American Journal of Tropical Medicine, and it says it's a Medline index. Southwest Asian Journal, this is more obscure, and this is the rating of the journals. Plus, neglected tropical diseases, that's a good one to publish in. This, I know that they will lower the fee if you ask nicely to the editor and say you don't have the means and your article is interested to them, they will publish. This journal does not charge readers or their institutions to access, for it is considered to be a high quality source. But also the author has to pay. It's the readers, us, that don't have to pay. So that's why you have to Journal of Virological Methods, if it's a method. Journal of Virology is a Journal of Virology, but you have the Indian Critical Care Medical Journal, Trends in Immunology, for example, if it's highly immunology, or if it's infectious diseases. Here's one, Cuadernos de Salud Pública, looks in Spanish. It's open access to. Human vaccine. So you have all sorts of journals, that journal infectious diseases and trends in microbiology, cell reports, Revista Chilena Infecciosa from Chile, many others. So you choose which journal you would like to, how, if you want to go PLOS or journal infectious diseases, which are hard to get into, or you want to try other journals. And then you can select the journal, I don't know, or show articles that are being published in that particular journal. And then you see if it fits, for example, in the identification of dengue-specific human antibody using phage display in this Journal of Methods of Molecular Biology. So maybe it fits yours or not, so you can review each journal and see what they have to offer. You can go back and do find articles. So here you get all the articles I have published in this topic, and you can narrow it down more if you want less articles, but then you can see all the articles, dengue encephalitis, antibodies, serotype dependent, Zika virus induced antibody with serotype 2. Gregorio is working on a lab that works with dengue antibodies and Zika antibodies. And now COVID. So here it is, partial maturation or immune evasion. So it has all sorts of possible contributions, journals that might fit your article. So the best fit you can find, the better. Because as I say, do this research, take the time. It doesn't take that long, half an hour. Take the time to choose your journal well, so that you have a better chance to being published sooner and not as rejected. But we all get rejections. You can find articles, find authors, and then you can refine your finding to be more specific what you want. Okay, I think it's very easy to use and it's a great tool, and I just wanted to share with you, but I think we're running out of time.
Well, we actually have 15 minutes to
our
program. Yeah, so but there are so many questions. I can go ahead with them if you would like.
Okay.
So there is a very good one, which is it possible to find journals that don't charge hundreds of dollars for a simple case report?
I don't know if there is a site where you're going to find non-charging journals, unfortunately. No. Gregorio, do you know? The only advice I have is that you ask the editor to not charge you. And if they do reduce the charges for authors. If you're very interested in a journal and you've done Jane and Elsevier and you think you're a really good fit for this journal, write to the editor. Send an abstract or a title and said, I'm considering publishing, I don't have resources to publish. I cannot cover the fee. Would you consider lowering the fee or eliminating the fee at this time? I'm from this country and we don't have the funds. And they will lower it. They will lower it. Maybe not eliminate it, but they will lower it. But you have to ask and present your abstract.
I don't think that all the time, but sometimes also you can also ask the editors whether there is interest in your story as well. So you can also send an abstract and a small cover letter and just inquire whether the journal would be interested in getting your publication. So that's also one way of checking. No, I don't think everybody would do that, but some editors would give you like evaluation.
Yes, if they are interested, they will publish it. Hopefully charge less. Very good.
Yeah, there are many questions about fees here, and this is very valuable piece of advice, I think. So another question from Natalie is, may publishing in a predatory journal damage your reputation for later publications? Are the journal of past publications taken into account by peer-reviewed journals when accepting a paper?
I don't
So,
know exactly
yeah.
the answer to this question. If you publish in a predatory journal, I don't know what happens. I've never done it. I don't know who hasn't had an experience.
I don't think that's going to damage your reputation,
Yeah,
but
no.
it's a journal that doesn't have visibility. So it's unlikely that people are going to read your paper, because when you publish a paper, your goal now is to be read and be cited. And if you're publishing a predatory journal, it's unlikely that people are going to first trust in your research, because they cannot judge how thoroughly well your paper was reviewed. So it's probably not the best choice to go, because you won't bring visibility to your paper, and people probably are not going to read much of it.
Right.
Yeah, that's my impression.
So it's a little bit of a, it doesn't ruin your reputation, but on the contrary, people would know that you published and you kind of wasted your day and your time publishing in these art in these predatory journals. But personally, I don't think you'll be affected. I mean, your reputation will be affected. Personally, you'll be in a disadvantage. Nobody's going to read your article.
I'm reading through the questions here, and another one that I found was very interesting is from Haitesh. It is it better to publish in low impact factor international journal or high impact local journal?
That's a good question. It's your choice. It's absolutely your choice in your career. Sometimes your topic makes more sense to use local journals because you want the country to know, you want the authorities to know, you have policies that you would like to improve, you have recommendations to change policy, or you know that it's a great interest of your country. If it's more of a basic science paper, it could internationally will work, maybe better, but it's your choice. It also depends the visibility you want for that topic and the time you want to wait to be published. So international is a little bit harder, but I think it's worth trying if your topic is a general topic with a good new bit of information that it will be important for the scientific community at large. But if it's a topic that's more related to your country, then you will do better just publishing in high tier journals in your country.
Thank you. So I'm going to open Natalie's microphone. I think she wants to say something. Natalie, now the microphone button is probably open for you at the bottom left of your screen.
Yes, thank you. Are you listening?
Yes.
Okay, hi. Nice
Hi,
to be
Natalie.
here. I just wanted to say regarding the open access journals, the directory of open access journals has the research tool where you can search for open access journals without publishing fees.
Ah, fantastic.
It's very easy to use.
So each open access journal will have a search, or where is the site?
No, it's in the website, the first search mechanism. You can use the topic and then search all fields. And then on the left wing, there will be the saying without article processing charges. It's easy to find and the own research tool.
Oh, fantastic. In which particular site do you go to?
Directory of open access journals.
Directory of Open Access Journals. Thank you. You said that at the beginning. Directory
Yes.
of Open Access Journals. Could you?
I can post it in the chat.
Yes.
Yes, of course.
We like to see things written down so that we can copy them.
Of course, I'll
Yes,
do
I'm
it.
gonna add all this to my presentation for the next group.
Okay. Thank you.
Thank you.
Thank you. And now we're almost done on time here, but I'm going to allow Hamid to talk. He also wants to add something. Please, Hamid, use the microphone button here at the bottom so you can mute yourself.
Yes, thank you. Hello, can everyone hear me?
Hi. Yes,
Yes.
we hear you.
Wonderful. Thanks a lot for the opportunity. I'm learning a lot. I just wanted to mention there's a nice journal which is quite reliable called ecancer.org. But probably this is not for everyone. It's for those colleagues who are interested in cancer publications and research.
Okay.
ecancer.org. I shared the link in the website,
Thank
but it's
you.
easy to search ecancer.org. It's a UK charity website, fully funded, and they usually support low and middle income countries particularly.